All right, I think we're going to get started. Welcome, everybody. My name is Michelle Lane. I am lucky enough to be the Senior Director for Community Health and Wellness here at NKC Health. And I am so excited to introduce this extraordinary group of professionals that I'm bringing you today. Not only is this topic so relevant, I read through these slides this morning and was like, oh my gosh, yes, I need to. Oh, yep, yes, I need to. These guys bring an energy and expertise and just the heart to the science that we need to learn this important information. So first, let's start with Dr. Dana. She is a physical therapist who earned her doctorate from the University of Kansas. Dana is also a certified yoga instructor here in the Kansas City area, and she loves combining evidence-based care with mindful movement to help people get better and stronger. And then next we've got Becky. She's a registered dietitian and also a personal trainer whose passion for individualized care has made her an absolutely trusted resource here at NKC Health. You say her name, people are like, oh my gosh, I love that girl. She knows everything. And then we've got Dr. Mallory as well. She's another highly skilled physical therapist with her doctorate who has a deep knowledge about the body and is so enthusiastic to help you guys learn today. She also has her certification in nutrition as well. And so I am just going to hand it off to these guys and let them bring us all these valuable insights that we need to know. Thank you so much. Take it away, guys.
Awesome. Well, thank you so much, Michelle. We are going to go ahead and get started. So this is our agenda for today. We are going to talk about the importance of muscle mass. We will touch on the potential side effects of weight loss medications on that muscle and strategies to really preserve that muscle and lose weight in a healthy way. Then we'll dive into all things exercise with our physical therapy ladies. So we'll talk about barriers, benefits, types, fall prevention, and then they'll offer some wonderful tips on how to begin exercising. All right, so let's kind of start from the beginning because we know that obesity is a very complex condition. It actually affects more than 2 in 5 Americans today. And it's very multifactorial too. So maybe we're predisposed to gain weight more easily from our genetics. Are we insulin resistant and our hormones impact our weight? Are we on a medication that one of the side effects is weight gain? You're on a weight positive medication. Are there areas of diet that we could improve on? Or do we have a lot of barriers that really interfere with our ability to get that physical activity throughout our day? So lots of things go into our weight loss journey. The good news is it's not your fault. You don't have to fight this alone. There are many, many treatment options available. And specifically here with NKC Health Total Weight Loss, we do have 3 different pathways that we can explore. We have our team of dietitians that work on the diet and exercise component. We also have our bariatric surgery team here. So they perform weight loss surgery, including the gastric sleeve, Roux-en-Y gastric bypass, and duodenal switch. And then we have our medication route. So we have our bariatricians and nurse practitioners that can work with patients to find a weight loss medication that works best for them. So let's dive into weight loss medications a little bit because the market has exploded with this. They are readily available. You can go to Sam's Club or get on a GLP-1 program with Weight Watchers. So very readily available. You can also go to compound pharmacies, medical day spas. So it's great. It's a great, great tool, and it's great to have so many options. But we do need to make sure that we're going about weight loss the correct way. The education piece is huge with this. Our goal is to maximize our weight loss while also minimizing any side effects. So let's talk about some of those potential pros and cons. As far as pros to weight loss medications, we know that it can decrease our appetite where we are getting filled up on smaller volumes. We also know that these weight loss medications can be incredibly helpful for decreasing that food noise, where we're not thinking about food 24/7. When's my next meal? What's my next snack going to be? We also focus a big component of our time here on those non-scale victories. So maybe we are improving our cardiovascular health. Maybe our triglyceride levels have decreased. Our blood pressure has decreased. Maybe our blood sugars are within a healthier range now. Do we have improved energy? Are we sleeping better? So we kind of look at that holistic side of things and not just that 3-digit number. Some potential cons, and not everyone experiences these by any means, but we might have some nausea, reflux, fatigue, or headache. With that delayed stomach emptying, we are at a little bit more risk for constipation, so we talk about that. And or depending on the medication, depending on what foods we're eating, some potential diarrhea as well. So why is muscle mass important? We know that muscle is metabolically active tissue, meaning that it burns calories even while at rest. We know that the more muscle that we have, the higher the BMR, that basal metabolic rate. And that basal metabolic rate is the number of calories our body is using while at rest. So yes, even while our body is at rest, we still need energy to do all the things that our body is able to do, including breathing and blood flow. We know that the higher our basal metabolic rate, the more calories that are burned for that protein rebuilding and recovery throughout our day. And the more muscle mass we have, the higher our metabolism, the more calories we're burning throughout our day. Okay. In terms of blood sugar, we also know that muscle mass can act like a sponge for that glucose. So let's say we eat a carbohydrate such as a slice of bread that breaks down into glucose. We know that some of that glucose can actually be stored in the muscles to be used at a later time. So the more muscle mass that we have, the more storage capacity we have for that glucose, which can relate to better blood sugar control throughout our day. Muscle is also very foundational for things such as balance and coordination in our posture, and just for helping us with our activities of daily living, such as carrying our groceries into our house, climbing up those stairs on our way to bed. So very, very important. Muscle is also very important for overall quality of life and longevity. We can actually extend our lifespan by having that muscle mass because it's helping to prevent muscle wasting. Muscle can also help decrease our fat cells that promote inflammation, so it can lower our risk for chronic disease. Muscle can help decrease or limit our falls. And muscle is very good for helping to regulate our stress and resilience. So there's a lot of positive impact on our brain health and overall mood. So we know that weight loss medications can be highly effective for losing weight. But like I said, we want to make sure we're going about this the correct way. So when we lose weight, we can either lose muscle or we can lose fat. We don't want to lose muscle. We want to hold on to every ounce of muscle that is possible. We also know that the quicker we lose weight, the more at risk we are of losing that muscle mass. In fact, research shows up to 25% of a person's weight loss can come from that muscle. Okay. So we know that if we're losing muscle, kind of the opposite happens of what I just discussed. We're decreasing our metabolism, so we're burning less calories throughout our day. And we also know that we're at a higher risk of regaining that weight later on, which research shows a lot of that weight regain is actually in the form of fat mass and not muscle mass. The less muscle, the weaker movement patterns, which puts us more at risk of increased energy, longer recovery times, and can affect our blood sugar in a negative way. So what do we do? How can we protect this muscle while losing weight? Okay, well, we've got to prioritize protein. This is a non-negotiable, guys, okay? Protein helps with protein synthesis or building that muscle tissue. We also know that protein helps satisfy us for a longer period of time throughout our day. So it can help support that weight maintenance. We really focus on emphasizing those high quality sources of protein. So think about your animals, think about your seafood, your poultry, your red meat, your eggs. all of our dairy products contain protein. Our beans and lentils, our nuts and seeds, some of that plant-based protein. Those are all great options for you. We really encourage you to try and include a protein source at every single meal and every single snack. Here at Total Weight Loss, we do recommend about 1.2 to 2.0 grams per kilogram of ideal body weight in terms of protein, and that's a minimum. So, for many of us, that may look like a good 30 grams of protein per meal, which is a lot of protein, I get it. And that's why we encourage our patients to also try to track with an app, with a food journal, for that accountability and for that awareness, and kind of see, what am I getting now for my protein versus where do I need to be? We always talk about protein first here. So when we sit down with our plate of food, really try to start with a few bites of that protein component. And that way, if we are getting filled up on smaller volumes of food, we're getting that protein into the best of our ability. And really focus on having those readily available, convenient options. Your plate does not have to look pretty. So utilize rotisserie chicken and tuna packets and canned chicken and, deli meats, jerky, high protein yogurts, and cottage cheese. And then we can throw in those fiber-rich carbohydrates and heart-healthy fats to get that balance, but also help with that satiety and energy throughout our day. And this is just some examples of some different protein sources. So if we had a 3-ounce cooked chicken breast, that would be about 25 grams of protein. A large egg, both the yolk and the white, would be about 6 grams of protein. If we had a half a cup of cottage cheese, we would get 12 grams. 8 grams of protein is found in an 8-ounce cup of cow's milk. The 2.6, this is the Star-Kissed kind of flavored tuna pouches, have about 16 grams. If we had an Oikos Pro Greek yogurt and added 3 tablespoons of hemp parts to it, we would have our 30 grams. And a 4-ounce cooked salmon would be about 20 grams in that fillet. So we can definitely find protein in a variety of foods. It doesn't just have to be our meat. Okay. Another big one as far as non-negotiables for me is our strength training, okay? Having some type of resistance to our activity. And the physical activity guidelines for Americans recommend doing some type of strength training a minimum of twice a week. And our physical therapy ladies are going to dive a lot more into this topic, so I'm going to let them take it away here in just a little bit. We do want to make sure that we're avoiding those really aggressive calorie deficits because once again, remember, the quicker we lose, the more at risk we are of losing that muscle mass. We also know that if we're not getting a lot of nutrition throughout our day, we're at a higher risk of those nutrient deficiencies. We love when our patients have access to a body composition scale, such as a DEXA, or here at Total Weight Loss, we have a Tanita scale. So we can track those body composition changes. We're not just looking at your weight. We're looking at where are we at with our muscle, where are we at with our fat. So if we come in and we've lost 5 pounds, we know exactly where that has come from. And that's why it's so important to work alongside a professional during your weight loss journey, because we can help you to lose that weight in a healthy way and also adjust, tweak those goals and that plan as we move along throughout your journey. All right, ladies, all you.
All right, so I'm going to talk a little bit about benefits of exercise. We know that exercise is important for a lot of things, but there's multiple good reasons. So it lubricates and gives nutrients to your joints. So there's something in your joint called the synovial membrane. This kind of acts like oil in an engine. So it just really helps everything in the joint move better. It also decreases pain when you've got a really good synovial membrane. So exercise actually helps stimulate the production of that synovial fluid that then help line the joint of the synovial membrane. When we strengthen muscles around the joints, this kind of acts as a brace to help protect your joint. So the stronger you are, the less strain on your ligaments, and this just helps a lot with joint pain. Also decreases your risk for injury. It can reduce inflammation. So exercise actually releases an anti-inflammatory that's called a cytokine. There's research that shows that even just 20 minutes of moderate exercise on a treadmill produces a measurable amount of the anti-inflammatory effect that comes from the cytokine. So actually more movement is improved to help with joint pain. It improves your blood flow. So synovial fluid kind of gets a constant supply of oxygen and nutrients when there's an increased blood flow. So increasing blood flow means even more synovial fluid going into the joint, which all helps. Exercise also helps maintain flexibility. So it can increase your range of motion, which can relieve stiffness and increase your overall body mechanics when you're doing functional tasks. And this can lead to decrease in pain as well. Improving balance and coordination. So the stronger you are, the more active you are, the likely that you are, or less likely you are to have any kind of falls. And we want to reduce all of your fall risks as well. Here's some other kind of benefits just that's beyond the weight loss besides the things that I just talked about. So it really decreases your anxiety and depression. So when we exercise, that releases endorphins, which is a chemical that just usually makes people feel a lot happier. This can help combat the anxiety and depression. You can sleep better, as well as decreasing risk of cognitive decline like Alzheimer's. So when you're exercising more, it makes you sleepier, it makes your body tired, which then is proven to help you go to sleep faster and stay asleep longer. As if if we're sedentary and we're not moving around as much, it's harder for our body to then want to go right back to bed. So movement is helpful a lot for increased and improved sleep. So talking a little bit about some barriers to exercise, because we know there's always something that can get in the way. So joint pain, we kind of talked about that. Sometimes that can limit, but we just kind of talked about how exercise actually can help a lot with this joint pain. Some people are just unsure of what to do, which in that case, that's kind of where Dana and I come in handy with physical therapy, as well as you've got personal trainers that you have access to. But, and Dana's also going to talk a little bit later about some exercises that you can do at home. But some people just aren't sure of what to do. Maybe you don't have a place or an equipment to exercise. Again, you don't have to have dumbbells and weight machines. You can do very functional exercises at home that help with all of this strength training, and Dana will kind of touch on that in a little bit. Maybe you're too tired, or there's just not that motivation there. And kind of tying back to another thing that we talked about earlier about fatigue. So you may be really tired, but you might find that doing little exercises actually increases you're just decreased likely to be fatigue. So then also motivation, that can be tough, but if you find somebody else to do it with, sometimes that can help with motivation. And then we know that just like schedule and time, everybody's busy, everybody's got a lot going on. So if you can just try to block a time or do something that fits in your schedule, don't try to pick something that doesn't sound fun or doesn't sound enjoyable, that's not going to fit in your schedule the right way. So just different types of exercises. We've got stretching, we've got aerobic exercise, and we've got strength training. We have people that come in and see us frequently that say, well, I stretch all the time. And stretching is great. It elongates tissue, it improves your mobility, but we really want to make sure that we're getting a good, rounded exercise program that may incorporate stretching, the aerobic, and the strength training. So that aerobic exercise is going to be like sustained multiple muscle groups with intent of raising your heart rate that is going to improve your cardiovascular health. So walking, biking, swimming, anything like that that's going to be a prolonged amount of time, just increasing that heart rate. And then strength training, which Dana's going to talk a lot about here in a little bit. It's just targeted specific muscle groups to kind of increase your endurance, bone health, joint health, and force production, which again are kind of some of those things that we talked about in the past as well.
All right, so strength training is a great tool for weight loss because muscle is metabolically active, meaning that it's going to burn more calories at rest. So aerobic exercise is still great. It's great for getting your heart rate up. It's great for your mental health too, and just feeling like you got a good workout. You're definitely going to sweat. But with aerobic exercise, you're only going to be burning calories while you're doing that activity. So when we think about the long-term effects or the long term of wanting to lose weight, theoretically, you would have to be doing aerobic exercise and maintaining that forever. So we pair it with strength training because that muscle is metabolically active and is going to burn 6 to 10 more calories at rest per pound of muscle. So this will help you keep that weight off after you lose it. Strength training is also important for fall prevention. So it's going to increase our bone density, which is going to reduce our risk for fractures. Our bodies are so powerful and they adapt to however we challenge them. And so when we do weight-bearing exercises, just meaning that you're using your body weight in some way, that's going to stress our bones in a good way, which challenges the cells in our bone to make denser bone, which decreases our fracture risk. Also, functional movements carry over into daily tasks that we do. So while you might not be squatting with a barbell on your back or anything like that, you definitely will be getting out of a chair frequently or getting out of a chair with something in your arms. So you want to have the strength to be able to do this. Another thing that comes to mind is carrying a weight in your hand. That translates over to like carrying groceries into your house. Also, strength training will increase our reaction time. So the signals from our brain actually get to our muscles faster and more efficiently. So then we can react to any missteps or losses in balance. And then Mallory had kind of talked about how strengthening our muscles acts as a brace. So you're less likely to say twist your ankle because your body then can react to those kind of awkward movements that we kind of find ourselves in sometimes. And our body can react to that without injuring you when we have more strength to protect our joints. So strength training, some ideas to kind of get you started. You can use resistance bands, machines, or dumbbells if you have access to this equipment. But then if you don't have access to equipment, you can also use your own body weight. So something like a squat kind of sounds daunting to start out with, but you can also just scoot to the edge of the chair, lean your chest forward slightly, and stand up, and you've already done a squat. Another thing you can do is push-ups or planks. Again, that can sound kind of daunting, but you can start up against the wall or putting your hands on the countertop to make that a little bit more accessible then for you. Another great thing you can do is activity in the water, whether that's swimming, paddling, or walking in the lazy river. The water makes us more buoyant, meaning that we're going to float just a little bit. And so if you're having a lot of pain with exercise, this might be a great place for you to start. This is just going to be less stress to your joints while you're still building the strength that we've been talking about. Without any sort of exercise, we'll lose 5 pounds of muscles per decade in our adult life, so starting in your 30s. When we're starting an exercise program, I want you to focus on compound exercises. So wherever you're sitting right now, maybe your thigh is up against the chair. And if you've got a clear space around you, I want to kick your leg out straight. So when you're doing this, you can feel that just the top of your thigh is working. That muscle is squeezing. This is a good exercise, but it's only using one muscle at a time. So if we then turn our attention to this guy who's squatting here, he's using the front and back of his thigh muscles. He's using his glute muscles, his calves. He's also having to balance, and he's using his core. So we want to, when we can, try and do exercises that are compound, like a squat is, meaning that it uses more muscle groups. A good gauge to know if an exercise is challenging enough for you is you should be able to do 8 to 15 reps and kind of sense that this feels like medium to hard in terms of difficulty. Let's say, though, that I can do 30 repetitions. That means the weight is too light and you're not going to be pushing yourself enough to get the strength gains that you're looking for. So really try and be in a range where you can't do 30. We want to push ourselves and challenge ourselves in order to truly build muscle. Something else I also like to think about is that you want to feel the muscles working, not necessarily joint pain. When you're starting a new exercise program, it's definitely normal to have some joint achiness, but we should be avoiding sharp pains. So the basics of an exercise program that the American Heart Association recommends are 150 minutes of moderate intensity or 75 minutes vigorous aerobic activity per week. You can break this up however you want to. So like 5 days of 30 minutes of moderate intensity activity, it would be a great place to start. And to know if you're in the correct zone, you would take 220 minus your age, and that's going to find your maximum heart rate, where we ideally don't want to push beyond. And then you find 50 to 70% of that, or 70 to 85% of that, to find out which zone your workout has been in. If you don't have access to a heart rate monitor, or if that feels like kind of daunting, you can also just do a talk test. So you should be able to maintain a conversation when you're doing moderate physical activity, whereas with vigorous physical activity, you would only be able to say a word or two. So moderate activity, I'm thinking like walking either in the pool or on land, maybe like easy cycling or riding a recumbent stepper. Whereas more vigorous activity would be like jogging, heavy yard work, harder swimming, those kinds of activities. They also recommend 2 days per week of strength training. Overall, just reducing your sedentary time and trying to spend at least 5 hours per week active in some way, even if that's not in structured exercise. So some tips to get started is that I would plan some time in your schedule that you plan to exercise and plan for barriers that you might encounter. So a barrier for me is always that I am hungry after the workday. And so I will bring a beef stick with me, and then I can't use that as an excuse for why I'm missing my workout that day. Also, choose an activity that you enjoy. For the longest time, I thought I did not like exercising at all because my only understanding of what that looked like was doing those HIIT videos where you're just doing lots of burpees, kind of go as hard as you can type of exercise. And that just wasn't for me. So try and find something you like better. Maybe that's yoga, maybe that's swimming, maybe that's walking, and just feel free to kind of explore those different ways that you can work out. Also, if you don't have, say, an hour to spare one day for exercise, schedule some exercise into your daily routine. So maybe you park further away at the grocery store that day, or maybe you have a doctor's appointment on the 5th floor and you take the stairs to the 2nd floor and then take the elevator the rest of the way up. Try and be creative about the different ways you can get your body to move throughout the day. I think group fitness is another great place to get started, and you can bring a friend. It's always great to have an accountability partner. And then just pace yourself. Don't do too much too soon. You can gauge this by your soreness. So again, we want to avoid those sharp pains in the joints. A little achiness in the muscles would be totally normal. And you just want to make sure that you can still like go up the stairs and get in and out of a chair without it causing you like pain or fatigue. That's how I like to gauge that you are not too sore. So if all of this seems like really daunting, it's because it can be. So Mallory is going to tell us about how you can get a referral to physical therapy.
So just a little bit how we actually have now direct access, which means you can come see us in physical therapy without an order from a physician. It changes a little bit. So we kind of have this limit of we can see you for 30 days or 10 visits, whichever comes first, before we would need a doctor's order. But a lot of times that's usually no issue. You can't come to a physical therapist, let's say like for weight loss or for just like trying to learn exercise. But if there's an issue like joint pain or back pain or anything like that, we see that all the time. We also do a lot of what's called prehab. So let's say that you're trying to lose weight so you can get a knee replacement or a hip replacement, or maybe that's not on your agenda, but you know later down the road you want those. We do a lot of prehab. So it's really beneficial to work on strengthening your muscles and getting the range of motion prior to having these replacements in your joints. And it just increases your likelihood of better outcome after the surgeries. So those are a couple things that you can come to us for. You always can come with an order, but you also can just call and we can get you set up for physical therapy for a reason as well. And then just collaborating with other healthcare professionals. So our job is going to be, how can we manage and safely prescribe exercise that's going to be beneficial to you, that can also be along the lines of your weight loss plan. Personal trainers can do this as well. We have dietitians like Becky who are just going to help a lot with that diet, supports muscle preservation, overall health. And then anybody else that just may be in your corner, like your primary care, your nurse practitioners, anything like that are going to help with regular check-ins to monitor progress, adjust things as needed, or sign off on an order for us with physical therapy if we feel like we need something past that 30 days.
Okay, that was absolutely so interesting. I loved it. So we've got some questions already in our Q&A. I don't know if you guys can see those, or I can also read them too. One of the questions is, what free food tracking app do you recommend?
Yeah, so we actually recommend the Berrytastic app for both our surgical and weight loss, medical weight loss patients here. So Berrytastic, and we actually have a code too that connects to our clinic, so we can always go in on the admin side and offer suggestions. But that's a great one. You can talk into it, you can scan food labels, you can connect it to your fitness watch, track your bowel movements, all the things. So that one is a great option. Some patients like MyFitnessPal or a food journal. So honestly, it might be helpful just to kind of look at some different ones and see what you preference. But that Berrytastic one is a pretty great app and it is free.
Awesome. Thank you. Okay, there is a question about, can you say the name of the scale that you mentioned, that you can read and see your bone mass, your muscle mass? What was that scale called?
So the DEXA is kind of the gold standard. These are very, very expensive. So not something people generally have for personal use, but maybe your primary care office has one. We have a Tanita that we use in our clinic here, but it uses like little tiny, you can't feel them, but little electrical impulses that are able to give us the information. We just can't have you hop on there if you have any type of an electrical implant, such as a pacemaker. But a lot of these wellness places do have access to some of these smart scales. And some patients that come in here even have insurance companies where they have a wellness point of that where they can get a free smart scale too. So it might be something to check into your insurance as well.
I love that. And I would also add on to that, the community health and wellness team here at NKC Health, we have a scale that we use out in the community. So how you signed up for this class, if you go back to that schedule, just nkchealth.org/classes, and you type in screenings, there's a list of different places where we're doing free screenings in the community. We typically will do hemoglobin A1Cs, cholesterol levels, and we bring that scale with us. So you can see that visceral fat, the bone density, and all those important numbers that you're talking about, Becky. Thank you. Let's see, back to the Q&A. It says, is Ozempic or the medication option for weight loss not recommended for those who are younger? I don't know who wants to take that one.
Yeah, so here at our clinic, we typically don't see anyone under the age of 16. It's usually a referral on to Children's Mercy. They have a whole weight management program where you have a whole collaborative team to help with that. If that's something that you have a child that you're thinking about, it'd be a great discussion just to start with their primary care provider, pediatrician, and kind of see what their recommendations are. But generally here, we usually don't see anyone under the age of 16.
Okay, great. I've got a question of my own. So historically, I've avoided weights in a sense of I felt like it was going to make me bulk up, right? And so I was like, I don't want to get all, big and beefy. From a perspective of a physical therapist, is that just like a myth or like a misnomer, or is there certain things that I should keep in mind so I don't put my muscle on top of my fat, really, to be quite honest?
So I do think it is a little bit of a myth. Like I remember when I started weightlifting, my mom used to tell me all the time, like, don't do that. Your thighs are going to get 3 times the size that they already are. But kind of like Becky talked a little bit earlier in the presentation, like muscle burns more fat. Like the more muscle that you have, the more fat that you're losing or burning or can burn. So just because and even if you wanted to weight lift 15 pounds versus 50, the likelihood that you're going to add muscle is high, but the likelihood that you are going to get like Hulk size is not likely. You can't really lay down, like you can have muscle and fat, but likely if you're building muscle, you're going to be burning some of that fat as long as you're also paying attention to what you're intaking food wise. Now, if you just continued with your like normal diet and was eating like 4,000 calories a day and then also trying to weight train, you may get bigger, but a lot of times then you may not have as easy of a time putting on muscle just because you're also may not be getting the right type of calories to benefit that muscle mass.
Okay, that makes
I
absolute sense.
think just to add to that too is a lot of people aren't pushing themselves hard enough to truly gain like that Hulk muscle. So like I was mentioning before, we want to be pushing ourselves to the point of failure in exercise, meaning I don't think I could do another rep or two if I keep going at this rate. So unless you're pushing yourself like really beyond that point, no, you will not be bulking up.
Okay, that's really good. That's great advice. Thank you. I also have another personal question. Becky, what about intermittent fasting in relation to protein intake? I love the science behind intermittent fasting, and I tend to do that. Does that affect this protein intake?
Yeah, it can definitely be difficult to hit that protein goal if we're taking an entire meal out. So if we just have 2 meals a day versus 3, that might mean 30 grams less of protein. So we do have some patients that do fast, and we just have to get a little bit more creative, and we could maybe not do the 18-6. Maybe, we can try a different type of one. I think too, just watching that body composition breakdown. I've had a patient that was fasting in the morning and we added just a protein shake. And she was able to then gain muscle by that next visit just from that little bit of addition. So I know when some people are fasting, they're okay with like what they're drinking for beverages. So we kind of use that one. But I think if you are truly only getting 2 meals in a day, we have to really be conscientious about what we're having for snacks throughout our day.
Okay, good question. Good. Okay, I love that. I've got one more. Somebody emailed me to. It says, do you make any recommendations on who you guys follow? Like who's the experts out there that in social media that I should be following, it says. I'm assuming in relationship to building muscle and eating protein.
I personally love Dr. Shannon. It's drshannon.dpt on Instagram. Her motto is fit body, happy joints. And so I have followed along with a lot of her exercises. If you find that you're working out in a way that it's like, this really feels like it's adding wear and tear to my joints, I think she's a great follow and kind of like unlearning all of those different ways that we work out and learning instead ways that we can build muscle in a way that's not hard on our body. I love her. I also love Squat University too, if you're just having a lot of pain with different things, and those are both on Instagram.
Love that. Thank you. Okay. Well, let me check the Q&A one more time, make sure I got everybody. Yep, somebody else added a question about, is it possible to gain muscle and keep fat, like bulk in a certain area? Example, the glute area. I think we kind of touched on that a little bit, right?
Yeah, so we can't decide that we want to spot reduce fat from anywhere. So losing fat is going to come from reducing your food or your calorie intake and burning more than you are taking in. But you can definitely build muscle in a certain area. So doing exercises that just target your glutes, you can make your glutes bigger if that's something that you're going for.
Love that. Awesome. Well, you guys have been an absolute wealth of knowledge. Thank you so much for sharing information with us today. And for the audience, this will be recorded and I will send it to you in a YouTube link, as well as some links to sign up for a physical therapy appointment, as well as other programs that North Kansas City Hospital is putting out in the community. We've got some strength training classes here in our fitness center and in our pool as well. And so I'll put that information in the email. And everybody have a great day, and thanks for joining us.